All right, so this is my head-to-toe assessment of my patient Natalie here, and she's going to be helping me out. So the first thing that I'm going to do is introduce myself to the patient and wash my hands for a full 20 seconds and do hand hygiene. My name is Shelby. I'm going to be doing a head-to-toe assessment on you, and I'm going to ask her what her birthday is, who the president is, her full name, just so that I can see the level of consciousness, also listening to her speech, making sure that everything's okay there and that her hearing is well. And I'm also going to check her wrist for her medical bracelet to make sure this is the right patient that I'm assessing today. And the next thing I'm going to do is start with the head area. So I'm first going to be just inspecting, because it's always inspecting, and then we'll palpate and percuss things. But as far as the head region, the scalp area, I'm just going to inspect first, make sure that her hair looks good, there's no like lice or any balding or anything like that. And you can just look around. Typically, you might want to wear like gloves while doing this. Next, I'm going to just palpate her head, just to make sure that everything feels okay. All right. So now from here, the whole time as I'm going through the assessment, I'm going to be constantly inspecting her skin. We want to look for the color of the skin. While we're palpating too, we also want to make sure that the temperature of the skin is okay. It's not too hot or too cold. You want to make sure that there's no lesions or any skin breakdown. So I'm looking at her face right now, and that's where we're starting at the head. And the first thing I'm going to do is, like I said, inspect everything and make sure that her face is symmetric, that like her eyes and her nose and her mouth, all the facial symmetry is normal. And then I'm going to also be looking at the moisture level of her skin and the texture and the skin turgor as well. And you can do that using a hand, just to make sure her skin turgor is well, for like just to assess dehydration and things like that. So next I'm going to start with the eyes right now. So the first thing I want to do is just make sure that her pupils and her irises and everything looks the way it should be. So I'm inspecting first. And then I'm going to do just some cardinal positions and also check for her pupil dilation and everything. So Natalie, if you could just stare at me, and I'll bring the light and watch her pupils constrict, which is what should happen. All right, and then just stare at the light for me real quick. And now we're going to do some cardinal positions of gaze. And just follow the light. All right, good. All right, good. Also, you could put gloves on for this part too, but you do want to just lightly pull down. Just look at me real quick. And just to inspect and palpate the conjunctiva, just to make sure that it looks normal. Next thing we're going to do is, I'm going to quickly just move to her ears since we're right here. You can inspect them, of course. Make sure that they are a normal size for the size of the head. Make sure that they're both even, that they're set back properly. And next you can palpate, and just to make sure that, you know, there's no pain or anything. Also inspecting the skin as well of the ears. And with a otoscope, you can also look in the ears. I don't have a real one, so I'm just going to look at the external portion of the ear. And then next, all right, Natalie, so what I'm going to do is have you just tip your head back just a little bit. So I'm going to just inspect the internal portions of her nares, just to make sure that there's no blood, there's no severe dryness, and everything looks good. You can also look for any abnormalities. Maybe they've had a broken nose before. Ask them about that. And then I'm also going to have her open her mouth. All right, now lift your tongue up. And what I'm doing is I'm looking at her teeth. I'm looking at her gums. All right, put your tongue down. And then stick your tongue out and say ah.
Ah.
So while I'm looking at the soft palate, I'm looking at the uvula too to make sure that it's moving the way it should be when she says ah. And also if you could just wiggle your tongue. Checking the range of motion of her tongue muscles and her cranial nerve there as well. So before I move anywhere else, I'm going to just palpate her face, her sinuses. Is there any pain or tenderness?
No.
Okay. And you also just want to clench your teeth for me. And you clench your teeth and you can feel the masseter muscle. All right, good. And then I'm also going to have you, if you could, this is another test for cranial nerve. Just squint your eyes really hard for me. All right. And now do a big smile. And now frown. And then puff your cheeks out. Okay. All right, good. And then puff your cheeks out again. And right here you can just feel as well and palpate the different muscles that you need to. So next, before I go anywhere down the neck, I want to make sure her lymph nodes, palpate her lymph nodes and make sure that also I'm inspecting to make sure there's no like lumps or masses or any like abnormal just increases in pressure. For instance, like jugular veins, things like that. But so I'm just going to assess all of her lymph nodes here underneath her mandible, her occipital lymph nodes, and just making sure that there's no pain and there's no swollenness for any of those either, because that could indicate an infection. All right, so next we're going to move to the neck area. So for her neck, I'm going to locate her carotid artery first. And of course, while I'm doing that, I'm inspecting her neck, making sure that there's no abnormal lumps, the skin is nice, there's no skin breakdown. So I find the carotid artery, and now what I'm going to do is auscultate it. So you auscultate the carotid artery, and what you're doing right now is you're listening for any thrills or bruits. Make sure that the blood flow is good and normal. Oh, I should probably put these in. All right, you can use the bell of the stethoscope as well. All right. Next, what I'm going to do is just go to the, what is it called? Trachea? Trachea, yep, it's the trachea. I'm going to palpate the trachea, and you do that, you can use both hands, you can use one, but typically both is better. And you just want to make sure you palpate all up and down it without hurting the patient, of course. Okay, so that seems good. And now, since we're at the neck, we want to look at the range of motion and make sure her muscles are all there. So if you could, just put your head to the side, now to the other side, and now go all the way back. Good, all the way forward. And now do a nice roll with your neck all the way around. A couple times. Okay. And now just look right at me. And now what I'm going to do is do it against resistance. So you're going to tip your head, but you're going to push against my hand, okay? All right, that's good. That's good. And now forward, push against it, yep. And now backwards. And then we're going to do this one. So you're going to go this way. So just go against my hand, yep. And now against that side, perfect. So that way you just check all the range of motion for their neck muscles. So now, from here, we're going to continue to go down. And the first thing I want to do is work on the heart and the lung sounds. So I'm going to start with the lungs and then move to the posterior side and do the lungs there too. And then we'll do the heart. So you have your patient sitting right here, and what you're going to do first is just inspect their skin, of course, especially if they have a gown on. You can just lightly inspect and make sure that their skin is intact. They don't have any weird like abnormal lumps or anything like that. I hope it's still going. Is it recording? Yes. Okay. And then you also want to make sure that their chest is not in or out abnormally too. So I'm just going to palpate quick, making sure I don't feel anything abnormal. All right. And then I'm going to percuss. So, well, actually, before I percuss, I'm going to do tactile freminess. And what I'm going to be doing now is just listening to the vibrations. So every time I put my hand like this, say 99, okay? So here, I'll start. All right, ready?
99, 99, 99.
Okay, and you're listening to the sound in the lungs making a vibration on your outer edge of your palm. So if you do that, you can do it with two hands. Two hands on the back is easier, or which might be easier for the front is you can do it like this, just making sure that you assess both of the same areas on either side while going down. Okay, and now I'm going to auscultate the lung sounds. All right, so just anytime you feel my stethoscope, just take a deep breath in and a deep breath out, okay? You can actually start up here too because you can hear the lungs really well. And then that side, and you go in a Z pattern. You can also tell your patient too that if they get short of breath, they can take a second. All right, and you go all the way down, and I'll just do this so you can see. You go all the way down while you're hitting the upper lobes first, and then the lower lobe, and then of the right lung, the middle lobe as well. So now, what would I like to do? You're also, just in general, while you're inspecting, you can watch their breath, their breathing, just to make sure that their breathing is normal, they're not having any trouble breathing while just sitting, no rapid breaths or anything like that too. So, all right, what we're gonna do now, Natalie, if you could stand up. All right, and if there's a way that you could sit so your back is facing towards the camera on here. So sit right here.
Oh, like this.
Yeah. So now, before we go to the heart, I'm gonna work on the lungs on this side just because we're on the lung assessment. So I get all worked up and I forget to breathe. I hate doing this. Okay, so once again, the first thing you're going to be doing is inspecting. You're making sure that the skin is all intact. There's no skin breakdown. You're looking at the moisture of the skin if you can, if they don't have a shirt on and things like that. You also want to make sure you're watching how their breaths are and if there's any abnormal expansion that you can see from your eye. If not, you can of course go on to the next steps, which you might be able to hear or feel. So right now, before we do anything, I want to look at the, what's it called, expansion, symmetric expansion. So I'm putting my thumbs together like this, and I'm going to have Natalie take a deep breath in and a deep breath out. Perfect. And what you want to see is your thumbs move apart and then back in a symmetric way, so you can see that both lungs are expanding properly and together. So next what we want to do is just palpate. Just want to make sure. You can ask your patient at this time if there's any tenderness or pain. Are you having any pain, Natalie?
No.
Okay. So you just make sure that everything feels good. Maybe give them a massage. No massage. Okay. So now what I want to do is I want to do the tactile freminess as well, the same way. And I'm going to use both my hands. And the same thing, when you feel my hands on your back, just say 99, okay? And we're going to make sure not to really go over the scapulas too much because you won't be able to feel everything very well, especially when you listen, you won't be able to hear very well. So try to get into the spaces. All right, ready?
99, 99, 99, 99, 99, 99.
All right, good. And now what we're going to be doing after that is we're going to percuss. So to percuss, you're going to go in a Z pattern, And try to get right into those spinal parts where you can actually, you go like in between so you can actually feel what you need to feel, or at least listen when you're percussing. So I'll start up here. I forget, okay. And like I said, you go in a Z pattern. It was hard. Okay. And you're just looking for any abnormalities while you're doing that as well. So next, we're going to auscultate and listen to her lungs on her posterior side. So anytime you feel the stethoscope, just breathe in. All right, ready?
Mm-hmm.
And you go, of course, from the upper lobes to the lower lobes in a Z pattern, listening to both at the same time or in the same area. That way you can tell if there's any abnormalities. And I'm going to have you lift your arm right here, and we'll listen under here. Okay? So in the right lung, there's 3 lobes, so I'm going to listen over here as well. And when you're listening to the lungs, you're looking for any abnormal sounds like crackles, stridor, let's see, what's another one? Wheezing and things like that. That's why you want to listen to all portions of the lobes, because sometimes you'll hear more in, you can hear that in one but not the other, so you really want to make sure you hit all the lobes. All right, and I think we're good for the back. So if you could turn around again. All right, and just sit right here. So now that we did that, we're going to work on her heart. So with her heart, when we're auscultating for heart sounds, you're going to be, it's the right side, okay. You're going to be going at the 5 different points. So you have the apical, and then you have the apical, the pulmonary, then you have the Erb's point, then you have the tricuspid, and finally the mitral. So the apical is going to be over here on the right side, and it's the second intercostal space on the right side, and that's the apical pulse. And then over here on the left side is your pulmonary, and that's the second intercostal space as well, and that's what is it, the left sternum. And then you go down to Erb's point, which is the third, and finally you go to the 4th, which is the tricuspid, and then the 5th, which is the point of maximum impact, which would be your apex of your heart, and that's also known as the mitral valve. So you're going to auscultate those points, and it's a rough Z pattern down the heart as well. The apex is, or the mitral valve, is also located on the midclavicular line at the 5th intercostal space. Okay, and then if you want to take their apical pulse, you would be listening for a full minute, and a normal pulse rate is between 60 and 100 for an adult patient. Okay, so next, well, I guess I have to keep these on. Next, we're going to go to her arms. While we're here, I'm going to just keep going down. So with her arms, you want to first, of course, inspect everything, making sure that the skin, like I was mentioning before, the skin turgor is good and all that. So you're going to palpate down her arm. You can do the other side too. And you're just feeling for any abnormal lumps or anything like that. So you also want to find the brachial pulse, making sure that you can palpate the brachial pulse. You can auscultate it as well. Ooh, I meant right here. And then also the radial pulse. Listen to the radial pulse as well. You can auscultate it. Okay? All right, now Natalie, what I want you to do, if you can for me, is just to put your arms out like this, and then put your palms facing out. And what I want you to do is bring your arms in, bring your arms back out, and now I want you to do it against resistance. So try to bring your arms to you. Yep, and now try to push them back. Like, go, like, put them down. Yep, perfect. And then, if you could just do like a range of motion, a circular one, with each arm. All right, good. And then if you could put your arms or your hands back out again and just do a range of motion with your wrists. All right, good. And now what you're going to do is pull up with just your wrists against resistance, and now pull back with your wrists like this. So push against my hands. There you go. And you're looking at, I hope this doesn't go off. Okay, good. You're looking at if she can go against resistance with her wrists and her arms. So now we're going to look at her, we're going to look at her hands. For cyanosis, we're going to look at the capillary refill of her fingernails. So you can press gently and release and look for the capillary refill there. And then I also want, if you can, just to just grab my fingers with your whole hand and then just squeeze. Okay, awesome. All right, so I think that's good for the hands and the arms. All right, so now what I want you to do is, well, I guess while we're here, so just dangle your legs for me. And we're just gonna, while we're here, check her reflexes and the reflexes on her arms as well. So I believe, I'm trying to think. Okay, so we have, all right, well, I'll try to just remember. So we're gonna check her brachial reflex real quick, and her, God, I can't remember the names of stuff. The, hold on 1 second, I need to refer back. I just don't know the exact names. No. Okay, yes, biceps and triceps. I don't know why I said brachial. So we're going to test the reflexes for her biceps and triceps and also her radius. So you're going to do like a little thing. This is not the correct tool. Yep, I can feel a little boom. So you do that on both sides. And I'll do that just on her her knees as well, and her Achilles, just while we're down here so we can get the reflexes all out of the way. So everyone remembers this one. And then you do that on both sides. Okay, and then you also do on her ankle too, on her Achilles. And you test those. Okay, so we got the reflexes out of the way. All right, now we're going to move to the couch so I can assess her bowel sounds and her abdominal region. So if you just lay down, Natalie, that would be awesome. Maybe this will be, there we go. All right, so once again, you're always inspecting first, but this is a little bit of a different assessment because we're gonna auscultate after instead of palpate and percuss before we auscultate. And the reason we're auscultating right away after we're inspecting and making sure everything's good is so that way, once we percuss and palpate, we're not going to be changing any of the bowel sounds or anything like that, because we want to be able to listen to the normal bowel sounds before we start moving everything around. So now, if you could just bring your shirt up to here for me. Okay. So we inspect the skin. We make sure that there's no discoloration. You can look for bruising. You can look for moisture levels, temperature, redness. Do you have any pain?
No.
No pain. Is there any pain while urinating? You can ask them that too.
No.
No, okay. So that's good. So after the inspection, we're going to auscultate and listen to the bowel sounds. And we're going to start in the right upper quadrant, and then go to the left upper quadrant, the left lower quadrant, and then the right lower quadrant of her abdomen region. So you want to listen for any, you want to listen for absent bowel sounds. If you don't hear any bowel sounds after like a few seconds to a minute. You could listen for up to 7 minutes, I think, but you want to hear some vowel sounds, and usually you will be able to. If there's no vowel sounds in that region or that quadrant, then you kind of want to take a closer look. Whoa, sounds weird. It's like, all right, and while you have your stethoscope on, you can also listen for any vascular activity. So basically, we're going to be listening right here towards the apex of the heart, or the aorta, the lower aortic valve, so we could listen to vascular activity too. Okay, and that one requires a little more pressure being put, so just make sure that your patient is comfortable and not in any pain. So next we're just going to palpate, and you palpate each region of the abdominal area, asking them if they have any tenderness, and you're also feeling for making sure that the fluid shift is normal and that you're not feeling any like distension or any masses of any sort. So you want to go like in a clockwise manner. All right, and next you percuss. Okay, perfect. All right, so now you can put your shirt down. So now we're going to go to the lower extremities while she's laying down here. You don't need that anymore. All right, so you would first check the femoral pulse, which we're not going to, but on a normal patient you would, which would be right here in the groin region. Next, we'll go to the popliteal pulse and make sure that we can feel that. Then you go down to the posterior tibialis pulse. And then finally the pedal pulse. You want to make sure that you can find all of those pulses. You can check for edema while you're down here as well. Also, like I said, you're always inspecting their skin and looking for any abnormalities the whole way down. So now, Natalie, while you're laying down like this, can you take your knee, your leg, and bring your knee up like that? All right, and then go like this for me. There you go. Back in, and then she would do that on the other side as well. And then what you're going to do with your feet now is if you could flex them and point your toes, and now bring them back. There you go. And now do it against my hand. Okay, and now back. Good. And you would do this on each side. All right, a normal point, and then push it back again. Okay, and then trying to think if there's any more leg stuff you can do. So if you just want to sit normally on the couch for me. Okay, so now we're going to look at the flexion and extension of her lower extremities. So if you could just put your leg out like this. Yep, and now bring it back in. Do it the same for this leg. Bring it back in. And now do it against my hand. There you go, good. Bring it back. All right, good. Against my hand, and now back. All right, good. And now if you could just stand up for me. We're going to do some stuff while you're standing. It's kind of the same as what you did back there. You're going to bring your leg out like this. Mm-hmm. All right, and now if you could bring it back a little bit. There you go. There you go. And now your other one. Put your leg out. Bring it back a little bit. Yes. You can assess for a level of consciousness while we're doing. No, I'm just kidding. Yeah, their balance and things like that, but it's the morning, so. Oh yeah, you initially check for a level of consciousness in the very beginning to make sure that, if you're working on a patient who's about to pass out, you kind of need to know that. So, all right, so now we're going to do this. Just bring your knee up like this, and then out, and you're looking at the range of motion for their hips. Okay, good. It's like yoga. Yeah. All right. And now, what I want you to do is come with me right here. And if you could walk toe to heel that way for me. Actually, just walk normally that way. Okay. You're looking at her posture, making sure that there's no, like hunch or there's no limp or anything. And now walk back heel to toe for me right here. There we go. All right, and now turn that way and walk on your tippy toes all the way that way. And now stay facing that way and do it backwards to me. So you're just making sure that they can do all these things without any issues. All right, and now if you could go like this to that side, yep, and now to the other side. All right, and now bend forward all the way down. All right, and then come back up and bend back a little bit. And you're just checking all of their stuff. Oh, what I did forget to do, I'll turn her around real quick. On her back, when we're assessing her lungs, it's a perfect time to worry about her kidneys as well. So where her kidneys are, you use a cup formation, and you actually hit on the cup of your hand just to make sure that there's no severe pain. If there's severe pain, there might be an issue with her kidneys. So, and I think that's it. Let me just double check. I'm going to assume and everything. Yep, range of motion, proximal distal, foot pumps. Yep. Okay, I think we did everything. And at this point, we're closing out and completing our assessment. And what I'm going to do is make sure if the patient was in their bed, I'm going to put them back in their bed. Make sure that the room is clean and comfortable. The bed is now lowered and locked into place so that they're all set and I can just continue on my way. All right, thank you.